two hilum, or one hilum, it is just attached with this, and the one renal artery is supplying the blood, also the bottom one. Okay, this is supernumerary kidney. Now dromedary hum. Dromedary hum like a camel hum, buffalo hum, like this part is so prominent and bulged out. So normal kidney, when we get normal kidney, how does it look like? Like this, right? So these are the cortex, and this is sinus. This is right kidney. Right kidney is less lobulated, and dromedary hum is not prominent. Dromedary hum is a cortical extension, usually from the middle part of the kidney. Cortical extension, it looks like a tumor, but it's not tumor. It's a normal functioning cortex. So I'm drawing look, this is normal functioning cortex. It looks hum, and it is more common in the left side, and it gives the kidneys a little lobulated formation, lobulation formation. So this is dromedary hum. Dromedary hum, and it is a normal functioning tissue, and it could be so prominent, sometimes it gives little as refracting shadow here, like that, and it looks like a tumor. If you don't pay attention, then you feel like it is a tumor, but it is not. Do not ever measure the dromedary hum. If you measure, then you are in doubt. What is the doubt? Anybody can ask you, why did you measure? You feel like it is a tumor, right? Now you have to rule out that it is not a tumor. How?
Putting color?
You got it. Put the color. When you put the color, then you'll see the artery, the same artery going to, and you have to multiply, you have to scan in supine view, in sagittal view and transverse view. In transverse, how it gonna look like? See? Normally, the tumor has its own capsule, right? Capsule means border, but here you're not going to see the border. Then ultrasound, then they will do the IVP, IVU, or they will do the CT, MRI, whatever they want to do it. Then they will not see that this is a separate mass. But keep that in mind. It is more common on the left side, and it is the cortical extension, usually seen like this. That is called dromedary hump. Okay, so
Would you have to document that?
yes, you have to document it. Then we'll talk about the Wilms tumor. Wilms tumor is after the name of Mr. Wilms. Another name of Wilms tumor is nephroblastoma. Nephroblastoma. And Wilms tumor, usually the patient is young infant. Usually 2 to 4 years old. But it can be before the birth. And it can be in adult age too. But the most common is 2 to 4 years. And it is the first, or you can say number one, pediatric intra-abdominal malignant tumor. It is the number one pediatric intra-abdominal malignant tumor. Do you know which one is the second common? Neuroblastoma. That comes from adrenal gland. Neuroblastoma is the second most common pediatric intra-abdominal malignant tumor, and Wilms tumor is the number one first. And now, Wilms tumor, let me draw the diagram, then you will understand. This is the normal cortex here, but something you see, the shape is changed. Which pole is it?
Upper
Huh?
pole. Lower pole.
No,
Upper pole.
upper pole, because the sonographic view, okay?
Oh.
Yeah. So now it is upper pole.
Yeah.
In the upper pole, compare with the lower pole, you see, oh my God, there is a extra bulging. And it is heterogeneous. Usually it arises from the sinus part. Then it extends towards the cortex. And it could be small, it could be gradually bigger. It may take off almost the whole kidney. So if there is a malignancy, so then what would be the complaint? The baby is 2 years old. Baby can complain to the doctor? No, they can. Their mom. My baby is crying all the time, and especially on the right side or left side or wherever. I put my hand over there, oh my God, they cry too much. Doctor, my baby, I can feel that something is there, palpable. Doctor, I saw my baby's urine is red. Hematuria. So, young age group, hematuria, pain or cry all the time, palpable mass, you can suspect Wilms tumor. And sonographically, it is a complex heterogeneous mass. Vascularity will be increased or decreased? Increased vascularity. So, usually it is unilateral, most of the time, unilateral. So, Wilms tumor is number 1, pediatric intra-abdominal malignant tumor. Okay? So, this is Wilms tumor. Then infantile polycystic disease, congenitally. Infantile polycystic disease, polycystic kidney disease. Infantile polycystic kidney disease, it is found in the infant and even before the birth. What you see? Polycystic kidney diseases. Polycystic means multiple cysts. Mostly it is microscopic and little macroscopic. So, this is a genetical disease. So, it's always bilateral. It is always bilateral. And enlarged kidneys. Hyperechoic. Hyperechoic kidneys. Non-functioning. Non-functioning kidneys. No bladder. Non-functioning means no urine formation. No bladder seen. No stomach seen. These are in fetus. And pulmonary hypoplasia. Pulmonary hypoplasia, it is also can be seen in fetal condition. And all together you will see Porter's syndrome is present. And non-compatible with life. Non-compatible with life. So always bilateral because it is genetical. These are enlarged kidneys. It's such a big kidneys. It may take off the most of the abdominal cavity. The kidney could be that big. Unbelievable. And both kidneys are hyperechoic. And just put the different color. You cannot differentiate it, the cortex and sinus of the kidney. You cannot. Because it has microscopic cysts all over. They said the renal tubules in the nephron, those renal tubules are congenitally malformed. As a result, all the tubes are dilated. See, remember proximal convoluted tubules, loop of Henle, distal convoluted tubule, collecting ducts, all are dilated like that. Dilated like that, and it's a microscopic. So now it says the polycystic means fluid collection, right? But it is, you're not going to see the fluid collection. Why? Because the cysts are so small and they are attached each other. Only the echogenic walls can be seen sonographically. As a result, it hyperechoic. And it is non-functioning. So as a result of non-functioning, no bladder you will see, because there is no urine formation, no bladder forms, and no stomach seen, because patient is not, baby is not swallowing, there is no fluid. And pulmonary hypoplasia, Porter syndrome is present, non-compatible with life, and oligohydramnios. Oligo. Okay? You need to remember these 10 points. Then you will figure it out that this is congenital infantile polycystic kidney disease. Okay, so the congenital things is over. So now I will go to the next pathology. What is the next pathology? The cystic.
Polycystic.
Yeah, polycystic are the cystic processes. So, cystic diseases in the kidney. Cystic processes. So, the first one, what I said? Adult polycystic kidney disease. Adult polycystic kidney disease. Adult polycystic kidney disease. That means it is the cystic diseases, multiple cyst in the kidney. That means multiple cyst, and multiple cyst is different shape and sizes. Different shapes and sizes. That means if this is a kidney, you'll see different shape and different sizes, mostly different sizes all over the kidney. And you will see it's bilateral, frequently bilateral. Frequently bilateral. If you see this kind of cyst in one kidney, you have to scan the other kidney too. And frequently. So then, in severe condition, okay, it is associated with other organs. What are the other organs? Liver, pancreas, spleen. What does it mean? If you see the cyst in the kidney like that, then you have to scan the liver. So liver may have polycystic diseases. So when you see the liver, pancreas, spleen and the kidneys, all are having the cyst, that is known as adult polycystic diseases. Adult polycystic diseases. These are found in the adult age. And if it is too many cysts, I saw a couple of cases. If it is too many cysts, you will see hardly you can see the renal parenchyma. And it's not going to grow that many and that big in one night. Gradually. So then you can write down gradual kidney failure. Gradually kidney failure. And it's not necessarily that both kidney will fail at the same time. No. When there's a gradual kidney failure, then you have to understand these cysts are getting more and bigger. More and bigger. When it is more and bigger, so then you will see the renal parenchyma, hardly it is all gone. You're not going to see any renal parenchyma. Means nephron is gone. So then, so ultimately what happened? This patient needs renal transplantation. Patient will go for dialysis, then followed by renal transplantation. So what would be the kidney size? Size of kidney will be increased. Size of the kidney is increased. Why?
Because of this.
Because multiple cysts and the cysts are growing bigger. So kidney is growing bigger. And whole kidney, you will see the anechoic area, See, like that. So you cannot miss it. Okay, so this is adult polycystic kidney disease. You need to know that I have to scan the other organ too. Okay, and kidney will be bigger, and it is frequently bilateral and gradual kidney failure. So in future they may need renal transplantation. So what is the next one?
Multicystic.
Multicystic kidney disease.
Polycystic.
Multicystic dysplastic kidney disease. Multicystic dysplastic kidney disease. What is the difference between adult polycystic kidney disease? Multicystic kidney disease usually in infants. Usually in infants and frequently unilateral. Frequently unilateral. What does it mean?
Only one kidney.
One kidney. Frequently one kidney is affected. So, then you will see multiple cysts of different sizes. So kidney size will be bigger. Is bigger. Kidney size is bigger. You will see the anechoic cysts all over the kidney. Problem is, if one kidney is MDK, multicystic dysplastic kidney disease, and other kidney is absent, then tell me what happened now. বাবা আমি পড়াচ্ছি ওকে আল্লাহ হাফেজ
They won't have functioning kidneys.
If one kidney is MDK and the other kidney is absent, agenesis. So what is going on? It is equivalent to
What is?
no kidney, right? My one hand is broken. I cannot work. And other hand is absent. I am equivalent to I don't have any hand.
Mm-hmm.
So that equal to no kidney. Equal to no kidney. Now understand, because this is a unilateral, mostly it is frequently unilateral, the other kidney is normal. So this baby, this infant may not be detected of having MDK until there is a symptom. But we do pregnancy evaluation ultrasonography frequently, right?